There have been cases of couples being blessed with as much as 5 or 6 children.
Yes, I have come across a few of them. If you have 5 or 6 babies inside, that woman is going to go into labor at an earlier date or an earlier stage. IVF is only meant for old women. That's
Correct.
not entirely true. It's a case-to-case basis.
There are a lot of women who are also freezing their eggs. So, what is the viability of those eggs? Welcome to yet another exciting episode of Seeds of Soul. Today, we are thrilled to invite Dr. Gaurav Desai, who is a fertility expert with a keen interest on minimal robotic surgery. And today, he will talk to us about a very interesting topic, that is the growing rate of infertility in urban India. Thank you, Dr. Desai, for joining us on Seeds of Soul. As a fertility expert, we would like to talk to you about various topics, about the growing rate of fertility issues in urban India, what are the myths that surround it, and what can we do to improve our reproductive health for ourselves and for the coming generations. So, thank you so much for joining us.
Thank you for having me.
And I would like to start off with the first question is that why is the fertility issue a growing concern in India?
So, over the past decade or so, we've seen a rise in the age of when a woman gets married or when a woman even thinks about having a child. So that is one issue, that's the start. Now, over the last few generations, as women are now employed, they are pursuing a career, they sort of try or it involuntarily happens that a woman keeps the marriage
pushing
the marriage and pushing having a child because of multiple factors.
Correct.
And what she doesn't realize is that the biological clock is ticking. So as soon as a girl is born, the number of eggs or the number of ova, what we call, starts diminishing. It starts reducing, and it sort of decreases exponentially after the age of 30.
You mean the quality or the production of
Both
eggs?
the quality and the quantity.
Okay. So, I mean, is it like that after 35 it becomes more difficult to get pregnant, or does it mean that the child may be born with some health issues? Is that?
So both of them. The number one thing is that the chances of an egg being released into the uterus, into the womb, is going to become less and less frequently. So the periods start reducing in number, and eventually by the 40s, the quality also starts going down. You have to remember that pregnancy is an egg and a sperm meeting and sitting inside the uterus, that is the embryo, which actually sits inside the uterus. Now, the other aspect is that the quality of the lining of the uterus also reduces. So, as age goes on, the tissues of the body start reducing in their quality. So, pregnancy, even if there is a pregnancy, it's more difficult to carry till full term. Delivery is more difficult. So it's a huge labor in itself is a exercise that a woman has to undergo, and it's not an easy exercise. So all this, as age catches up with you, it becomes more and more difficult.
Okay. That brings me to the next question. Is the onus of fertility completely and entirely on women, or does it plague the opposite gender, that is the male also? I mean, do they also deal with infertility issues, and is it as much a rampant issue with men as much as it is with women?
No, absolutely. I mean, infertility is not just about the woman, it's about the man and about the family, about the entire ecosystem surrounding that couple. So even in males we have problems of infertility. It could be related to the sperm count, it could be related to their job. I mean, in today's day and age, we have men who sit with laptops on their lap, so there is an increase in temperature. So that reduces sperm quality. This is just one example. So the infertility workup, when we have a couple who comes and sits in front of me,
Yeah.
is directed to both. We look at the sperm count as well as the woman, and we see what's wrong.
Okay.
Sometimes both are wrong.
But if we were to put it on a scale, say hypothetically we were to put it on a scale, how much do you think that infertility is an issue that is plagued by women, that infertility plagues women, and how much does it plague men? If you were to put it on a hypothetical scale of 10, say 3 is men and 7 is women, or is it half? Where do we stand?
Yeah, it is more, I think, skewed towards the woman, because there are multiple factors and multiple organs involved. Eventually, it is a woman who will carry that baby, that fetus, the child.
Correct.
The male provides the male gamete, which is the sperm.
Correct.
But the woman has the ovaries, the tubes,
Correct.
the uterus in itself, the mouth of the uterus or the cervix, the vagina in itself. So there are multiple parts of the woman's anatomy that are involved. So there are factors in each of these parts.
Correct.
Whereas in males, it is primarily the testes, the producing of the sperm, and that's about it. Just the connection between the male and the female.
Okay. Now, as we have established that the infertility is a growing concern. So, is IVF the only method that a couple can employ for trying to get pregnant, or are there other methods that are available? But before that, I would also like you to shine some light on what IVF process is, and what is the success rate of an IVF procedure.
So, IVF is, of course, very widely known. It was probably one of the first assisted reproduction technique, what we call as ART.
Correct.
Which is an assisted, it is basically to assist the couple to have a child.
Correct.
Now, apart from this, in fact, one of the most common methods is actually a non-IVF method. Just a simple method where we sort of time the intercourse, where we tell the couple that these are your fertile dates in the calendar. That improves the outcome.
Yeah.
After that, we have medicines that we can give. So we can stimulate the ovary in case she has a problem of producing the eggs. So we stimulate the ovary to produce eggs. The next problem is, of course, releasing of the egg. So
Correct.
we have medicines or injections which we give to release the egg if that is the problem. The next problem is, for instance, what we call as an IUI. An IUI is not IVF. It is not.
What's the full form of IUI?
The IUI the full form is Intrauterine Insemination. So
Okay.
this is where we take the sperms of the male partner or the husband, we purify it, and then we inject it. It's a non-invasive method. It's not really a surgery. It's an outpatient procedure. So we place it within the uterine cavity. Remember, when sperms are deposited in the vagina is acidic in nature. It's sort of the body's natural way of killing germs that
Correct.
enter through that pathway.
Correct.
Now, sperms, if they are placed in the vagina, quite a few of them are destroyed. This is during natural intercourse. Very few of them actually reach the mouth of the uterus,
Yeah.
and even fewer enter the uterus.
Okay.
So the mouth of the uterus itself has what we call as a mucus plug. Okay, these are just natural sort of protective barriers of
yeah.
a woman. So the number of sperms entering into the uterine cavity is very less. So if we can sort of bypass these two methods by placing these sperms, the purified sperms, directly in the uterine cavity, that
And
improves
timing
the
it with the monthly cycles.
and timing it with a sonographic assistance of that egg
Correct.
reaching that uterine cavity, that improves the fertility outcome slightly. Remember, it's not 100% or it's not 90%. I think that the public has to realize that these are very modest increases. And remember that these are only assisted reproduction techniques. Even
Okay.
IVF, for that matter, we mainly use IVF in women who are, the age is catching up with them, who have other medical problems
Sure.
like endometriosis, like any other pelvic problem. So in them, anyway, the chance of fertility is reduced.
Yeah.
And even IVF is, not as high as 60% and 70% and 80%.
What's the chances then?
Yeah. So it's usually in the range of maybe 20-30%. I mean, that's average, in the sense that, so when couples come, you have to give them a realistic picture. They have their hopes so high up that IVF is a guarantee.
Is a done deal.
Yeah, it's a done deal. We're going
Correct.
to get a kid, and we're going to have a kid in hand after the 9 or 10 months. So that is not the realistic picture.
Absolutely.
And I think there's a lot that goes beyond all these assisted. They are just assistants. They are not
Correct.
the core of fertility.
Okay, but let me ask you a layman's question. Would you put the risk of success? What is the risk of success for these procedures? Say, if you were to put a number to it.
So, a normal couple who has a normal fertility life would probably have a 10 to 12% chance of getting pregnant in a year. So, that's 1 month in a year.
Correct.
Probably these methods of assisted reproduction increase it to about 15%, 20%, 25%. That is usually the increase that we see.
Correct.
So, in IVF, of course, we take an egg either of the female partner or a donor, and of course the male sperm, and we sort of attach it, or we sort of join them outside in a it's a test tube baby. It's sort of in a controlled environment, and then that is placed within the uterine cavity. So it is an artificial method, and one that has a lot of sort of legal there's a lot of paperwork involved, and it's not the ideal way, but it is just to assist you in having a child.
So speaking of legalities, we have come across a lot of cases in the media. So let me not name them, but it is there in the media about ladies who are actually getting pregnant with the IVF procedure, and they are 60 plus. So as a doctor, and with the specialty in gynecology, what would be your comment on it? Because I think that this is kind of giving birth to another Frankenstein.
Yeah. So as I said in the beginning, over the last generation or two, women are having children at a much later age.
Correct.
It used to be 20s, maybe in a grandmother's time. It was 30s in our parents' time. Now it's 40.
Correct.
So as years have gone by, the life expectancy
but over here, the woman has already gone through menopause.
Yeah. So, in the sense, now life expectancy has increased. But remember, it's not just about the woman's age or having a pregnancy. It's also who's going to raise that child once the child is born.
Yeah.
So, for instance, the child is going to look, and the mind of the child is going to look at
and there's going to be so much of age gap, right?
Yeah, a mother who is probably in the previous generation was at the age of a grandmother. So that having a child, assisted reproduction is of course technology, and with AI coming in and these advancements, it will become more and more effective. But one has to realize the social impact that this has. It's not only easy, not only difficult for the mother who is 60 and 70 to give birth, but also to raise the child.
And it also puts an entire stress on the extended family also, because they also have to step in to take responsibility for the member. So do you think that are there any steps that are being taken by the regulating bodies and government to monitor these treatments for patients?
Yeah, I mean, there are efforts to not only to make a law, to sort of have legal implications for this this sort of injudicious use or just uncontrolled use of IVF or ART methods, but also to educate. I think we need to sort of do more to reach the public and to go to the grassroots levels and even reach kids and young women. Because they have their lifespan ahead of them.
Correct.
And they should not grow up saying, hey, well, a 60 or 70-year-old woman can have a child, because for them that might seem to be normal.
It actually puts forth a skewed perspective in that.
Yeah, so it is not, so like I say, these are assisted reproduction techniques which are meant to help you in certain cases. So for instance, in women who have cancer, for them to have these methods is fine, because they have to sort of take out sometimes their genital organs, the ovaries, the uterus. So to help them is a different thing. But when everything is normal, it should not be sort of taken for granted that, you can always do IVF and, things will be fine.
So, speaking of assisted ART that you've been mentioning, there are a lot of women who are also freezing their eggs. So, what is the viability of those eggs? I mean, just because it's cryogenically frozen, are those eggs viable to be used at a later time? Also, is the lifespan also impacted? Does that work?
Yeah. So, one thing, when I get patients who ask me about this and, who are not sure when they're going to get married, when they want a child. So I always say that, first of all, you're going to take eggs out of your body and place them into a cryogenic chamber, and that has to be sort of maintained.
Correct.
It's like a deposit in a bank, and you have to sort of maintain that. It's not forever and ever. I mean, there is a life period to that. So a few years at the most. At the end of that, they will, of course, the specialist will take out those eggs, check them for quality, see if that quality is good enough to get transferred at that time. So, this is not like a lifelong investment.
Guarantee.
It's not a guarantee.
Correct.
So, it's just there to sort of keep your mind at peace that, listen, I have these, it's not getting destroyed in my body, because remember, every menstrual cycle there will be one egg which will get destroyed.
Correct.
So if it's sort of in the near future, yeah, I mean, that is one way of doing it. It's a good option, but it's not one size fits all. So you need to
have a more pragmatic approach.
Have a pragmatic, it's individualized. You have to have a consult with your gynecologist and actually sit and, see where your life is and when do you plan to have a child.
Correct. I think that's a very interesting perspective. So, is fertility issues only limited to urban India, or have you now come across cases of it being in rural India, or is it something that is like just rampant all across?
So I've traveled all across the world, and you have multiple fertility issues in every part of the world.
Correct.
Usually in the non-urban part, the tier 2 cities, the tier 3 cities, initially there was tuberculosis, which was very rampant in our country. That causes fertility issues.
Correct.
So it basically destroys the uterus, and it prevents a woman from not only conceiving but carrying the child. Here, I mean, on the other hand, we have women with fibroids, with the ovarian cysts, with uterine issues, which actually cannot conceive or need a surgery to conceive.
Correct.
We are now
Why are these issues growing so much? I mean, why? How is it something that has got to do with our lifestyle?
Yeah, I think, I'll give you an example. One of the diseases which is actually a pandemic. I mean, people know about COVID,
yeah.
But the pandemic of that pelvic surgeons are having to deal with now is called endometriosis. So that is something that we spend hours operating every single day.
Could you explain what endometriosis is for our viewers?
Yeah, so endometriosis is when the cells or when the tissues of the lining of the uterus, that is the endometrium, are actually found outside that uterus. Okay, so they are found in the pelvis, in our abdomen, in different parts. It could even be found in the chest. They just spread all across.
But how does the lining go out of the uterine parameter and spread across?
So there are many theories to this. So one of them is a reflux theory. The other one is a metaplastic theory. So in layman's words, it's probably the cells of a woman's body suddenly they have sort of a flaw, a genetic flaw, and they sort of mimic the endometrial tissue, or they get the qualities of that tissue, or that endometrial lining is implanted into various parts of a woman's body. So whenever she has a period, that tissue as well will behave the same as the inner lining. So it will constantly bleed and will sort of be fibrosed, which will sort of harden. So this is what endometriosis is. So, and that causes major fertility issues. So
why is it growing so much in recent times?
So there are multiple.
Is it just hormonal?
No, not at all. I mean, I think there are so many factors which are involved. One of them is stress. The other is a delayed, a woman who is not having a child for some time, who suddenly decides to have it much later. So endometriosis is basically has a number of factors. I mean, even environmental factors play a role. So there are, for example, links to sanitary pads, sanitary
the chemicals in sanitary,
the chemicals in perfumes, in beauty products. So all this plays a role in pesticides, what you intake. I mean, there is a lot of research going on, which is linking endometriosis.
So it's not just about the food that we eat; it's also about the products that we use. Even maybe as much as I read an article that even the toiletries or the floor cleaners that we use, that also actually has a major impact on a woman's hormonal health. So yes, so I would also want to understand what are the myths that are surrounding fertility, because obviously there must be many. So what are your few favorites?
So the few favorites, I would say, one is, of course, as I said before, IVF is like a guarantee. That's the myth. The other is IVF is only meant for old women. That's not entirely true. It's a case-to-case basis. Even young women sometimes might need assisted reproduction. Then the other myth is, if you have an assisted reproduction technique, there's probably a chance that the child may have some anomalies or may be born a little abnormal. It's very rare. Probably, at least in my practice, the ones that have had IVF and I have delivered, they really have not had any major problem as such. I mean, not above the normal way of conception.
Correct. So IVF is a procedure that has got a lot of PR footing, right? So, but with the growth in medical sciences, are there other procedures or treatments that would be available in the recent future? And if you could educate us on that.
Yeah, so to assist fertility, there are a number of new technologies. There's, of course, artificial intelligence, there's augmented reality. Remember, to assist fertility is not just the IVF or the laboratory procedures, but also the surgical aspect of it. So we are having 3D laparoscopy, which is coming in, improved high definition vision systems that are coming in to assist in operating these women, to operating pathology on these women, like fibroids, like endometriosis, ovarian cysts. They all are linked to fertility related issues. So in that sense, technology is definitely assisting us and will keep improving to assist fertility.
Sure. So in IVF, there have been cases of couples being blessed with as much as 5 or 6 children. So have you ever come across any such case, and what would be your comment on it?
So, being a practicing gynecologist, we come across all sorts of cases. And yes, I have come across a few of them. Much less common now than what it was previously. But these are sort of part and parcel of practice. And yes, there are cases where the IVF transfers quite a few embryos in the uterus. And then, in fact, people have to do selective reduction of some of them, so that the other 1 or 2 actually survive. Remember, and if you have multiple pregnancies, they usually result in preterm labor, because the uterus can only expand so much, and after some time, if you have 5 or 6 babies inside, that woman is going to go into labor at an earlier date or an earlier stage. Have a good sort of physical activity, go for a walk,
regular
play
workout,
games,
yes.
Do what you did as a child. I mean, do what we used to do, eat home food, or at least, watch what one is eating. Frequently, people are now eating outside. You don't know what people are putting in the food. Young kids are watching too much of television. There is the internet, the mobile phones, technology. All this has come in and is, of course, playing a role on the child's brain.
On the collective health, both physical, mental and spiritual.
Yeah, so have a very holistic life. There are relaxation methods. Remember not to indulge in drugs, not to indulge in any such method that will ruin your life and your career.
Correct. So thank you so much, doctor. It was really fun to have you over. Thank you so much.
Thank you.